Which of the following is not a feature of the neuropraxia? So neuropraxia, it is a form of the nerve injury. We know there are three important types of the nerve injury. The mnemonics is the NAN, which is NAN. N for neuropraxia, A for axonotmosis, N for neurotmosis. So which is not a feature of the neuropraxia? That is the first type. Here the options are the transient delay in neuronal transmission, axonal degeneration distal to the site of the injury, absence of neuroma formation, preservation of the autonomic function, absence of axonal degeneration proximal to the site of the injury. So which is not a feature of the neuropraxia? So first of all, let's see the different type of the nerve injury. So first of all, which is the mnemonics is the NAN, N-A-N, N for neuropraxia, A for axonotmosis, and N for neurotmosis. In case of the neuropraxia, what occurs in the neuropraxia? In neuropraxia, there is pressure. Here we can see there is pressure on the outer covering, which is the myelin sheath, and the inner axon is completely intact. So inner axon is completely intact and myelin sheath is slightly compressed. So initially some problem occurs, but within this time it is fully recovered. And here we can see there is no need of increase the axon length because axon is completely intact. The second one is the axonotmosis. That means in this condition axon is damaged in this condition area. Here we can see the axon, this area, this is the axon, this portion of the axon is completely destroyed. So what happened in this condition? It also recover, but slowly the proximal axon increase, and the distal part, it is removed by our body macrophage, and it is known as the Wallerian degeneration, because the distal part, it is usually phagocytosis done by the macrophage. And the last one, which is the neurotmosis. In case of the neurotmosis, the axon is damaged, also the covering, which is the myelin sheath also damaged. So the myelin sheath damage, axon damage, that means it is the severe form of the nerve injury. So what happened? The distal part, again it is destroyed by the phagocytosis by the macrophage, and Wallerian degeneration occurs. In this condition also macrophage destroyed the distal part, and which is known as the Wallerian degeneration. So Wallerian degeneration occurs in the axonotmosis and neurotmosis, but in case of the neuropraxia there is no Wallerian degeneration. So here again see the neuropraxia, which is the most simplest form of nerve injury, and here the nerve is very intact and electrical conduction is affected for some times, but it is fully recovery possible, and autonomic function usually preserved, and Wallerian degeneration usually not occur in case of the neuropraxia because axon is intact. As the axon is intact, so there is no the Wallerian degeneration. Now the second point, which is the axonotmosis, that means the name axon, that means the axon is damaged and the myelin sheath is completely preserved or intact. The connective tissue framework is not affected, and Wallerian degeneration occurs. So Wallerian degeneration occurs in the case of the axonotmosis. And last of all, which is the neuronotmosis, that means the complete neuron damage. So axonotmosis, that means the axon damage, neurotmosis, that means the neuron damage. That means neuron, it is formed by the axon and by the myelin sheath. So axon and myelin sheath. So here the axon and also the myelin sheath, they both are damaged, and also the surrounding connective tissue is damaged, and this condition Wallerian degeneration occurs. And let's say in this last two options, that means in case of the axonotmosis and neurotmosis, what occurs? This axon, it will increase in size, and finally what occurs? In some point it may be form a ball-like structure, and which is known as the granuloma neuroma. So neuroma may form in case of the axonotmosis, in case of the neurotmosis. And in case of the Wallerian degeneration, in short about the Wallerian degeneration, what is Wallerian degeneration? It is the axonal degeneration distal the site of the injury. So again this picture here we can see site distal to site of the injury. That means that part is completely destroyed or completely removed by our body macrophage, and actually this part is damaged. So axonal degeneration distal to the site of the injury typically begins 24 to 36 hours. So the Wallerian degeneration, it occurs distal to the site of the injury, and axon are excitable period to the degeneration occurring. That means the before the Wallerian degeneration starts, axon usually excitable that time. Myelin sheath degenerates and it phagocytosis by the macrophage. So it is completely destroyed by the macrophage, and fully recovery may occur 6 to 8 weeks after the nerve injury. Wallerian degeneration does not usually occurs in simple neuropraxia. So Wallerian degeneration usually not present in case of the neuropraxia. Autonomic function is usually present in case of the neuropraxia. So which is not a feature of the neuropraxia? It is the axonal degeneration distal through the site of the injury, which is known as the Wallerian degeneration. So Wallerian degeneration usually not occurs in case of the neuropraxia. Transient delay in the neuronal transmission, it is true. Absence of neuroma formation, it is also true because it occurs in the axonotmosis and neurotmosis. Preservation of the autonomic function, it is also true. Absence of axonal degeneration proximal to the site of the injury. Actually here the wall type of the degeneration absent in case of the neuropraxia.